Well, welcome everybody to this second of 3 reform films on priorities for the new government's first 100 days. Andrew Alderby, Director of Reform, here again. This film will look at the implications of an ageing society, which has so much importance, particularly in the areas of pensions and health. That's what we're going to cover today. Very grateful indeed for the participation of Will Mosseri-Marlio, a senior researcher here at Reform, and Alex Hitchcock, appearing in his second film in this series, researcher here. Let's start with Will. So on the pensions side, the biggest budget, I think, of any of the public spending areas, what should the new government's key focus be?
Well, I think it's probably worth setting out very briefly what the challenge is of an ageing society. So as our population grows older, then there are two problems from a macroeconomic perspective. The first is that the tax base narrows, so we generate less revenue, and the second is that age-related spending on, as you mentioned, pensions and healthcare increases. Now, the new Pensions Minister, Richard Harrington, will have a lot on his plate in the short term, including what to do with Tata Steel, the exit charge consultation and the auto-enrolment review in 2017. But we think that there should be two focuses for the new government. The first is that the government should scrap existing policy, which is to increase the value of the state pension in line with the triple lock. Now, the triple lock ensures that the state pension increases by the highest of earnings inflation, or 2.5%. It's an incredibly generous settlement for pensioners. It costs £6 billion in 2015-16. That's money that could go, that is currently going to a relatively affluent segment of society. In the long run, however, the triple lock is, according to the Office for Budget Responsibility, the government's fiscal watchdog, undermines the sustainability of the public finances. Now, the second point is that the government needs to think very carefully about the state pension age. The former Chancellor, George Osborne, set out the principle that a fixed proportion of life should be spent in retirement. John Cridland, who is the former Director General of the CBI, is leading a review for the government into changes in the state pension age after 2028. If he decides that there is an argument for further increases in the state pension age, we think the government should not bulk, but we also think that there should be a focus on supporting older people into work, because otherwise increases in the state pension age might simply result in unemployment, and this area is going to be the subject of a report from Reform early next year.
Perfect. I agree with you. Do you nevertheless think it is politically feasible for the new government to withdraw from the triple lock on state pension increase?
Well, I think it's certainly the right policy option. I think one of the
to take away the
triple lock. I think one of the clearest things that we've seen in welfare policy since 2008 has been a schism in the incomes of working age people and pensioners. Now, if Theresa May wants to make good on her campaign pledge to deliver an economy that works for all, I think scrapping the triple lock and redistributing some of that welfare expenditure towards working age people would be a way to go.
Perfect. Thank you very much indeed. Alex, turning to the health side, another, of course, huge area of public expenditure. Please give us your two highlights for the new government.
Sure. So clearly it's wonderful that everyone's living a lot longer than they have been in the past. But with that has serious health implications, of course. As people get older, they're more likely to get unwell, and so the NHS is called into action there. I think really the new government should focus on the ageing society in terms of health in two key ways. The first is today's ageing society, and the second is tomorrow's ageing society. It's never too soon to think about that. So on today's ageing society, we know, for instance, that there are more people over 65 than under 16. We also know that older people are more likely to have long-term health conditions. So about 60% of people over 60 have a long-term health condition. And clearly that is, really has significant implications for the NHS in terms of resources needed. And in terms of caring for these people with diabetes and other chronic conditions, really the NHS would do well to ensure that people got the care they needed very early on and up front. So instead of being pushed into hospitals, which is inconvenient for patients and expensive for them, they should receive their care at their general practice, and GPs should ensure that people therefore don't need to go into hospital. So really that involves two key things. The first is have a workforce that's more diverse than it currently is. Currently it's centred around the GP, but actually you see that in larger general practices, in scaled up organisations, you can have a more diverse workforce, including diabetes nurses, for instance, physios, other nurses and mental health professionals there, and also use technology as well, because this shouldn't be overlooked, I think, in the context of an ageing society. So this can help deliver care in people's homes, which is far more comfortable and cost efficient. So turning to tomorrow's ageing society, we know, for instance, that 1 in 3 people born today will live to 100 or over, which again is a wonderful thing, but really the government should ensure that they therefore prevent people getting the sorts of long-term health conditions that we're seeing today. So there are wonderful programs across the globe in terms of preventing people getting cancer through smoking, cessation, and also helping people reduce obesity rates in other countries. And really what the NHS needs is to incentivise providers to focus on this prevention, which means incentivising them to care for not just one section of a person's care pathway, but in fact the whole care pathway, which gives providers a responsibility and incentivises them to focus on care up front and prevention.
Thank you. So I mean, what you're saying at the end there is a very major reform to the NHS, the way it's funded, and then the style of organisations are going to be the NHS. Do you agree with me that the new government has just got to seriously accelerate the pace of change towards that new model? Yeah,
absolutely. So Jeremy Hunt spoke for reform very recently, in which he said that actually with these Brexit and other significant political changes, what this means is actually we need to focus more on changing the way care is delivered and getting value for money for the taxpayer. So I really think that now provides a key opportunity for the NHS to accelerate its reforming path. The NHS is focusing on using technology, to take one example. Absolutely, that's wonderful. But really it should push this agenda ahead to ensure that it sort of lays the ground for a sustainable healthcare system.
Thank you. So I hope that sums up quite nicely what we're trying to do here. You can see we've got a very, very strong focus on both pensions and healthcare in our work at Reform. We think these are core areas of the new government, and we really look forward to engaging with you on our active programme going forward. Thanks so much for joining us.